Bacterial vaginosis, or BV, is a common vaginal condition. It happens when there's an imbalance in the bacteria naturally found in the vagina. Don't worry, it's not a sign of poor hygiene. Many factors can disrupt the delicate balance of your vaginal flora. Think of your vagina like a garden. A healthy vagina has a good balance of good and bad bacteria. These bacteria work together to keep your vagina healthy and happy. BV occurs when the bad bacteria start to outnumber the good guys. This imbalance can lead to some uncomfortable symptoms. But the good news is that BV is easily treatable. With the right information and care, you can restore your vaginal health and feel like yourself again. Remember, you're not alone in this. BV is incredibly common, and talking about it openly helps break down stigma. Let's dive deeper into understanding BV and how to manage it effectively. You might be surprised to learn that the Centers for Disease Control and Prevention, or CDC, lists BV as a sexually transmitted infection, or STI. But hold on, it's a bit more nuanced than that. While BV can be associated with sexual activity, it's not always the case. BV is considered an STI because it's often diagnosed in women who are sexually active. Having new or multiple sexual partners can increase the risk of disrupting the vaginal microbiome, making BV more likely. However, BV can also occur in women who aren't sexually active. Factors like douching, certain soaps, and even hormonal changes can also upset the balance of bacteria in the vagina. So while BV is linked to sexual activity, it's not always transmitted like other STIs such as chlamydia or gonorrhea. It's important to remember that having BV doesn't mean you've done anything wrong. It's simply a common condition that many women experience at some point in their lives. Let's talk about your vaginal microbiome, a fascinating ecosystem of bacteria that plays a crucial role in your vaginal health. This community of microorganisms, mostly made up of good bacteria called lactobacilli, works tirelessly to maintain a slightly acidic environment in your vagina. This acidity acts as a natural defense mechanism, protecting you from infections and keeping everything in balance. However, certain factors can disrupt this delicate balance, leading to an overgrowth of bad bacteria, such as Gardnerella vaginalis, and causing BV. Think of it like this. When the good bacteria are thriving, they keep the bad bacteria in check. But when the bad bacteria get the upper hand, it can lead to the uncomfortable symptoms of BV. Understanding the role of your vaginal microbiome is key to understanding BV. By learning how to maintain a healthy balance of bacteria, you can take proactive steps towards preventing BV and maintaining optimal vaginal health. Section 4. Recognizing the symptoms of BV. Bacterial vaginosis doesn't always cause noticeable symptoms, and some women might not even realize they have it. However, when symptoms do occur, the most common one is an unusual vaginal discharge. This discharge might be thin and watery, or it could be white or grayish. Another telltale sign is a fishy odor, which tends to be more noticeable after sex or during your period. Some women also experience itching or burning around the vaginal opening, but this is less common. It's important to note that these symptoms can also be caused by other conditions, so self-diagnosing isn't recommended. If you're experiencing any unusual vaginal symptoms, it's always best to consult with a healthcare professional for a proper diagnosis and treatment plan. Section 5. The importance of seeking treatment. While some cases of BV may clear up on their own, it's crucial to seek treatment from a healthcare professional. Untreated BV can increase your risk of other infections, including sexually transmitted infections and pelvic inflammatory disease, or PID. Moreover, if you're pregnant, having BV can increase the risk of complications, such as premature birth or low birth weight. The good news is that treating BV is usually simple and effective. Your healthcare provider will likely prescribe antibiotics, either oral or vaginal, to eliminate the overgrowth of bad bacteria. It's essential to complete the entire course of antibiotics as prescribed, even if your symptoms improve before you finish all the medication. Remember, seeking timely treatment not only helps clear up the infection, but also protects your overall health and well-being. Section 6. Taking charge. Tips for prevention and wellness. While there's no foolproof way to prevent BV entirely, there are steps you can take to maintain a healthy vaginal microbiome and reduce your risk. First and foremost, avoid douching. Douching disrupts the natural balance of bacteria in your vagina, making it more susceptible to infections like BV. When it comes to intimate hygiene, gentle is key. Use mild, unscented soaps and avoid harsh chemicals or fragrances in your vaginal area. Wearing cotton underwear and loose-fitting clothing can also help promote airflow and reduce moisture, creating an environment that's less favorable for bacterial overgrowth. Remember, knowledge is power when it comes to your vaginal health. By understanding the factors that can contribute to BV and adopting healthy habits, you can take charge of your vaginal well-being and enjoy a happy, healthy life. If you found this video informative and helpful, please consider liking, commenting, sharing, and subscribing to stay updated with the latest insights and advancements. Your support helps us continue to provide valuable content. Thank you.